It is the popular saying that a healthy society is a wealthy one. On the Great Mind program, medical experts are available to provide solutions to various health challenges. You desire greatness in life. Successful men and women in the society are available on the Great Mind program to reveal to you the secrets to their greatness. The Great Mind of Nancy Oshogbo is a watch for all. Meet me on the program every Sunday between 3:30 and 4 p.m. Happy Sunday to you all, our viewers at home. This is another wonderful moment with me, Ola Olayode, on the program The Great Mind, the program that reveals the secrets to the true and lasting success. The personality we are celebrating on the program this week is the former Chief Judge of Lagos State, Justice Omotunde Samuel Ilori, who rose from the pulpit teacher to become his Chief Judge. Meanwhile, on the segment is sponsored by Osun Health Insurance Agency. We are discussing the operation of the agency, the commitment of the leadership of the agency to ensure that the people of the state have access to quality health care without tears. A bill to ensure the actualization of the vision of being a world-class provider of access to sustainable, qualitative health care readily available and affordable to every resident in Osun State, as well as making the people of the state to access quality health care without tears. Osun Health Insurance Agency has an effective organizational structure with committed people at the helm of affairs, making things work in accordance to the passion which Governor Adegboyega Oyetola has for the well-being of the people of the state. Since it is an acknowledged fact that an healthy society is a wealthy one, Honorable Adeoye Adelakun is the chairman, board of directors of Osun Health Insurance Agency.
Going forward in the new year, we wanted to actually increase our reach in the informal sector, because the informal sector is normal because the salaries are deducted at source. But the informal sectors, unless they appreciate it, the value they are going to get from it, they can't be involved. And since people are really talking good about the scheme, and they have good things to say that has happened on the scheme, we need to let people know what they are capable of getting if they are part and parcel of the scheme. So we have actually tried to rev up our advocacy such that we will reach more people in the informal sector to be part and parcel of the scheme, such that the mind of Mr. Governor, because he's passionate about the health of the people, and that is why he is supporting the program such that it can succeed. So we are particularly reaching out to more people to be part and parcel of the program. And I believe that by the end of this year, there are more that will be in the net of the insurance scheme that will enjoy better health patronage through the scheme.
Dr. Adeniji Ogene is the Executive Secretary, Board of Directors of Osun Health Insurance Agency.
Talking about assessing the performance of this agency or our scheme in providing quality health care for the people of this state in 1 year. The most objective means of assessing performance is by the use of data. What have we done so far? Now, if we look at the beginning of the scheme, none of the civil servants that are presently on the OE scheme were on insurance, state civil servants. But as we speak today, we have 38,516 civil servants or public servants that are on the scheme. That is what is happening. And for these 38,516, we already have, enrolled 36,539 dependents. They are still coming. Initially, when we started, we were going everywhere. Ministries, departments, and agencies, local governments, telling them, come and enroll, come and perfect your enrollment so that you can start accessing care. They say, it is a government project. It's a government thing. It will not work. They're just disturbing us. They just want to be deducting our money. Be deducting the money. We're not interested. That was the initial response. So even when we gave them the forms to fill and they want a picture of their children. They want picture. Who has time for that? This scheme is working very well. Civil servants, public servants, they are going to receive this. Right now we have a total of 75,055. That is as at the end of March. As I speak to you now, the number has increased of those who are enrolled. The dependents are increasing by the day, because they are now bringing their children's birth certificates, they are bringing their marriage certificates to authenticate their spouses qualification for the scheme. So people are enjoying this. That's concerning the formal sector. Now concerning the informal sector, we have a total of 1,251 persons already that have enrolled, market women, Okada riders and things. We have 1,251. The principals there is 1,138, and then dependents, we have 113 dependents amongst those who have already registered. Now we also have the enrollees under the priority population. We call it the priority population for the vulnerable persons, people that are living with disabilities who are not employed, the old pensioners that are earning very little sometimes, some of them 3,000, 5,000. We have put some of them on this, and we still ask the Nigerian Union of Pensioners to add more names. The more we have them in their various pay units, the more we capture them so that they can begin to enjoy the scheme. And for the priority population program, it is free of charge. That is the one we call free health under Osun Health Insurance scheme, because it is the Osun Health Insurance scheme provides services to people on equitable basis. If you have small money, you pay small money. If you have you don't have money, you are not a worker, you don't have any means of livelihood and things, you get the treatment free of charge. And then if you are a high earner, you pay to subsidize for those who are. That's the principle in social health insurance: social solidarity and equity. So based on that, we already have 15,050 persons. 15,050 persons that are already registered with us. Some have already started receiving services. Out of all of this, of course, I said the albinos, the people living with disabilities, and then the aged, pensioners and what have you, they are all included in this 15,000.
Dr. Adebisi Olalere is the Director of Planning, Research and Statistics for Osun Health Insurance Agency. His department has amongst its responsibilities monitoring and evaluation.
The department has a duty schedule. Actually, we have budget, preparation, we have planning for activities or any event in terms of operational plan. Also, we have research activities in my department. So basically, those are the activities that we carry out, and some strategic plan in terms of making policy. That is some strategic plan that we actually make the government to make a policy that will actually improve the health system of the state. So basically, this is my schedule of duty as given by the Osun Health Insurance Agency. The actualization of the objective, we are in this department want to do what they call monitoring and evaluation. We are to monitor the healthcare provider in terms of their activities. Are they actually performing what is expected of them? So we move from one place to another to what? To actually do the monitoring and evaluation to make sure that our patients are being taken care of, and that most of the time we talk about the percentage that is supposed to be collected from them. That is 10% of the drug administered. We want to go around and see that people are not, exploiting people in terms of saying, go and buy this, go and buy that, go and buy this, go and buy that. So my office here, which is in charge of monitoring and evaluation, we move around from one hospital to another. Not only monitoring the healthcare provider, we also monitor the HMOs, those people that are the intermediary between the healthcare provider and us. So we monitor them so that each time there is anything in terms of referral, that they have to take a authorization code from the HMO before you can transfer a patient from one place to another for a secondary care.
Dr. Shino Igbalaye is the Director, Standard Quality Assurance.
Get enrolled by Osun Health Insurance Agency, and then you can choose any facility of your choice among the accredited facilities, and then with that you'll be able to access care. For emphasis, I want to say one of the advantages of getting enrolled or getting on board Osun Health Insurance is to reduce financial hardship. It also to reduce out-of-pocket expenses. From all of the things that I've mentioned, and even from our benefit package, all you need to do, you need to pay, that will take care of the preventive, the promotive and curative aspect of our management, is the fact that you only need to pay 10% of drug costs. That is where drugs are involved. For investigations, they are covered. For counseling, medical screening, they are covered. And then by the time you pay 10% of drug costs, you can imagine what we are talking about. If the drugs being given is about 10,000, you only need to pay 1,000. If the drugs given is 1,000, you only need to pay 100 naira. So it's important. Of course, this would help you and the family, and it will not amount to creating unnecessary hardship on the family members. So this is one of the things that Osun Health Insurance has been able to do, and the advantage of actually getting enrolled onto the scheme is what I just mentioned. And with this, I want to encourage everybody. I want to encourage the citizens of the state that they should try as much as possible to become a part of the Holis family, so that we all can enjoy a dividend. One of the things that the state government of Osun, led by Alhaji Boyega Oyetola, has done, and we are all happy, and we appreciate his effort, we appreciate his support, and we must say that we give kudos to his giant strides in the health sector.
Fam Olasupomi Sumono is the Director of Program Osun Health Insurance Agency.
Of all agencies of government, I make bold today to say that I still want to know any agency that is more scientific than Osun Health Insurance Agency. Scientific in the sense that all our methods and procedures are backed by internationally verified scientific procedures. Understand? And each of our departments, you can see something like Osun Health Insurance Scheme strategic objectives. We know where we are going. We know how we are going to get there. And the logistics for getting there, I think that is one of our major strengths, as backed by the present-day government. The logistics for getting there, we didn't face any difficulty, unlike other states, in getting the logistics of getting to where we want to go, we want to get to. And as of today, I make bold to say that we are in the forefront of the state social health insurance scheme in Nigeria.
Mr. Arubulu Eluyemi is Director, Administration and Supply.
Departments deal with appointment, promotion, and discipline. Basically, the woman taking care of the human resources of the agency. And the supply aspect of it, they'll deal with basically the procurement aspect of the agency. We do the due diligence in the area of procurement of goods and services, and taking into consideration institution and tandem with the public procurement law and financial regulation and public service law. It is true we used to say that Osun Health Insurance Agency is quasi-private agency because we deal with both public and the private sectors, and that is why the way we work here is a little bit different with the way other civil servants are working. We don't have a closing time unless until we make sure that all our activities for the day has been upgraded, and we always have a target of each week and every day. We have a target to meet, and when we meet it's only when we meet the target that you cannot say that you want to go home. So you don't say it's between 8 and 4. No. So that is why, because we deal with general public and we work around the clock.
Osun Health Insurance Agency is actualizing the vision of being a world-class provider of access to sustainable, qualitative health care without tears for the people of Osun State, because the mantle of leadership of the agency is being steered by the committed and focused heads. You are welcome to the segment where we celebrate the achievers of our time. As I said earlier, the personality we are celebrating on the program this week is the former CJ of Lagos State, Justice Omotunde Samuel Ilori, who rose from a pupil teacher to become the Chief Judge. The former Chief Judge of Lagos State, Justice Samuel Omotunde Ilori, was born in this house at Tarapates Ilori's compound in Omofe, Ilesha on January 5, 1934, 74 years ago, to Mrs. Comfort Ilori and late Chief James Jegede Ilori. Justice Samuel Omotunde Ilori, who is now the chairman of the Association of Private Refinery Owners in Nigeria, started his elementary education at the Holy Trinity Primary School, Omofe.
My father became the High Chief Arakpache of Ilesha when I was still very young. I think she ascended the chieftaincy around 1945. So that is where I was during my primary school days and things. But I was still attending Omofe School. In Omofe School, I took part in all sorts of activities, in sports in particular. I was the captain of Ogudengbe House in our sports thing, and I later became the senior prefect of the school. So when I left in 1950, I did not go to a secondary school. Yes, I got admission into Edu College in Benin City, but at that time Benin was such a far away place from Ilesha, and my father wouldn't allow it because it had a sad experience with one of my brothers, his eldest son, who went to school at a far place and died eventually. So when I took the exam and passed, they said, no, you are not going to Edo. Unfortunately, I didn't sit for the Ilesha Grammar School thing, you know, children wanting adventure. So I wanted to go somewhere else. So as a result, I had to start teaching. In those days, they call us pupil teachers. And I started teaching in 1951 as a pupil teacher.
Having been a pupil teacher for some time, Justice Omotunde Ilori proceeded to United Kingdom to further his education.
as luck will have it, one Saturday I came home to our house at Omofe, and I met somebody sitting in the house right opposite my father's house. And I went there and challenged him. "You are a stranger in this place, man. What do you want?" He said, "How can you call me a stranger in my father's house? The owner of this house is my own father." I said, "Is that right?" Then I said, "Baba, this man says it's your son, no?" He said, "Yes, you know." You see, we became friends, and we started talking. He said he was going to England, and he just came home to receive his father's blessing. I said, "Oh, you must have had a fantastically good education." He said, "No, I had teacher's training, grade 3 teacher." I said, "I'm grade 3 teacher as well." He said, "Yes, that's what I have." I said, "And how can you be going to England?" He said, "Well, they were looking for mental nurses. So if you want to be a mental nurse, then they will allow you to go there and be a mental nurse, and you study it and get qualified and things." I said, "Well, I don't mind going." "Oh," he said, "Yes, I can arrange it for you." So when he returned to Lagos, he sent me what they call the Nursing Mirror, a nursing magazine. That is where he got his own idea of being a nurse. So there were advertisements for students, and I picked the one at Gloucester. Gloucester Mental Hospital, they call them at that time. They are now called psychiatric hospitals. So I applied, and within a month, a letter came to me from the Ministry of Education of Western Region inviting me for an interview. I went there, got the interview, I was selected to go, and then of course I filled the passport form in the ministry. They took me to Adeoyo where I did the x-ray and sent my papers forward to the passport office. Within a month, I had my passport delivered by registered post. You see, by that time I had lost my father. My father died in 1954. So when the thing came, passport, then I told my mom, "Here is my passport. I have to go to England, but they require somebody to stand guarantee for me." He said, "You go to England? What are you talking? Go to England?" He said, No, stop it. What education do you have? Who is going to be responsible for your going?" He said, "Stop that silly talk and things like that." I said, "Well, I'm going." Then I went to my uncle, the late Mr. Famogwele, my father's cousin, and told him. And I said, "Oh, well, he was a teacher at the teacher training college." He said, "You're going to England, my son? Okay, I'll sign your guarantee. You know?" I said, "Well, you need," they say whoever signs the guarantee must send the particulars of his house. He said, "Yes, I use my house as guarantee for you. You can go." So he gave me all the documents of his house, and I sent them away. And I went to the principal of Elisha Grammar School at that time, Reverend Canon Akinyemi, father of the present Professor Bolaji Akinyemi. He was my father's very good friend. That gave me the courage to go to.
Justice Omotunde Ilori came back to Nigeria in 1964 and enrolled in the law school. Since he has started law practicing, the journey has been rapid and blemish-free. In 1965, he got the appointment with the Federal Ministry of Justice as a state counsel. He became the Director of Public Prosecutions in Lagos State in 1978. In 1979, he rose to become a Solicitor General and Permanent Secretary. A year later, he got an appointment as a High Court Judge. 16 years after, he was appointed the Lagos State Chief Judge. Justice Samuel Omotunde Ilori is a man fully committed to service to humanity. He has touched the lives of so many people. In recognition of his contributions to the development of the society, he was honored by the Osun State government in the year 2007 with the State Award of Excellence. Retired but actively robust in intellect, since his retirement, Justice Ilori has been carrying out difficult consultancy services. Justice Samuel Omotunde Ilori is the Chairman Association of Retired Judicial Officials in Lagos State, members Nigeria Society for International Law. He is a member of Nigeria Society of Criminology, member Frontlines Club. He was the chairman Lagos State Marriage Guidance Council between 1990 and 1999. With all these activities, Justice Samuel Omotunde Ilori is still committed to the God's service. Having risen from just a pulpit teacher to a chief judge, Justice Omotunde Ilori has this piece of advice for all.
The people out there should not say, I am disadvantaged. They should struggle, have an aim, have a goal, struggle at it, no matter how hard it is, and make sure you get to where you are going. I had no secondary school education. I had nobody to pay my school fees, even at university, yet I went through it, got to where God has decided for me.
In an effort to alleviate the suffering of Nigerians and ensure regular fuel supply throughout the country in the next 2 years, Justice Samuel Omotunde Ilori is now on a refinery construction project in Lagos. As I always say on this program, that with hard work, diligence, and perseverance, you and I can attain any height, crowned with the grace of God. With that, we are ending this week's edition of the program. Next Sunday is another date. God willing, till then, stay blessed.